The case numbers, Wayne, in South Australia, virtually none, only those that are in Medi hotels. So why can't someone who isn't vaccinated serve someone who's come in from a car crash at a local hospital if she's not posing any risk to any of her fellow staff?
And on the flow today, we take a look at the issue in South Australia about the specific details surrounding whether or not restrictions will be eased. And there has been some news about that this morning, Ricky, which we are looking to cover, and also some of the implications on our country health and services that have been provided in regional areas.
Yeah, there sure is. So the Marshall government have indicated that when they reach the 80% double jab rate next week, they're saying that among the many changes that they expect to be able to make is there will not be a statewide lockdown again. Now, that's something we want to hold them to if they ever try and go down that path again. But they're also saying the close contacts of those who've got a case of COVID-19 are not likely to have to quarantine as much as others, so long as they're vaccinated.
It's interesting on that note, there has been concern about mandatory vaccination of health workers, and we made an inquiry to the Limestone Coast Local Health Network to discuss this issue. We believe that there were nurses and doctors and other care workers at aged care centres that were not vaccinated and were going to be stood down or would lose their positions. Of course, the response didn't come from the Limestone Coast Local Health Network, but it was forwarded up to the SA Health, of course, and we got their response, which was to indicate that they believe that all of their staff in the Limestone Coast Network were vaccinated, albeit they said 97% of staff had received their first dose and 93% their second dose. I'm not quite sure whether that's all, Ricky.
Well, no. Well, it's also the key word there in that comment they've got from SA Health is rostered. Only the rostered staff have been fully vaccinated, as they like to call it. There's plenty who aren't rostered. They've been put off on leave because they've refused to vaccinate. We've been reaching out to the South Australian opposition to comment on this and the state government, and we get these standard responses from health. I had worked over the weekend to have the Shadow Minister, Chris Picton, speak to us today on the radio, and he's backed out at the last minute.
And it seems interesting because I did ask Nick McBride, the member for MacKillop, about this last week. We tried to get a comment from him, and he said that he knew no more than we did from the media. So I take it that Nick's not getting a lot of information from the health service either.
Well, I come back to that comment I've made regularly on your show, Wayne, that we're being run by a mediocracy, a medical government that is running things, and there's a lot of people who've just gone, well, we'll just let them run things because we're scared of the pandemic. And it's not playing in the hands of actually when it comes to whether an emergency department at Karoonda Hospital is going to be able to be open 24/7 or not. This statement here is saying to us they're going to fill the gaps with graduates.
It is, and those graduates won't have the experience of 30-odd years of care within that institution, and also will be coming out without the necessary qualifications to undertake all of the things that you learn on the job. I mean, let's put it bluntly, that nursing and medical practitioners do a lot of learning on their job.
Well, look at the case numbers, Wayne. In South Australia, virtually none, only those that are in Medi hotels. So why can't someone who isn't vaccinated serve someone who's come in from a car crash at a local hospital if she's not posing any risk to any of her fellow staff?
I think that's the point that has been made, and there is going to be some pressure because Parliament in South Australia is sitting this week, and the whole issue of whether or not mandates come into place for workers, South Australia hasn't made its decision on that. Queensland and New South Wales and Victoria have, and that decision, of course, has been quite detrimental to many people's employment. And we're talking here about the issue now coming before South Australia. If people are concerned, they should contact one of the four independents in the state, because if a vote comes to that position of mandating workers, that could become something very significant in terms of what they vote.
Well, if you look at the party who says a lot about workers in the parliament, it's the Labor Party, but are they going to turn up? The independent vote is only activated if Labor turns up and works with them on a motion. They want to play politics with this, Labor, and play it safe. So I think that people need to contact the Labor opposition, such as Claire Scriven MLC, who tends to be their spokesperson on regional issues, to see if Labor will actually front up and participate in whatever the independents are trying to do.
What we're hearing just about everywhere we go is that people are not looking for mandates for work, that they believe that we can continue on the way we are with those that are vaccinated and those that are unvaccinated continuing to do their roles as they have been up until now. We're still working in those particular jobs. Those nurses were working up until the 11th of November in their roles until this deadline is met. And so it seems that that's what the public's position is, but it doesn't seem that that's necessarily where the bureaucracy is coming from.